The Senate is in session. I received a message from Her Excellency the President. It is dated 22nd of April 2022, and it reads as follows. Dear sir, I have the honor to inform the Honorable Senate that, pursuant to Section 75 of the Constitution of Barbados, and acting in my own discretion, I have appointed Dr. the Honorable Chelston Whitley da Costa Brathwaite, CHB, and Dr. Christina Giselle Hines to be members of the Senate with effect from the 8th day of April 2022. Yours faithfully, the President. Please admit her, Mr. Clerk.
Yes, may I hear your name? Dr. Hines.
Welcome, Dr. Hines. Senator Cummins.
Thank you very much, Mr. President. I rise on this occasion to welcome one of our two new senators to the Honorable Chamber in a new capacity. She is no stranger to commentary and to debate on matters relating to governance as a political scientist herself from the University of the West Indies, and I have no doubt that she will bring her extensive commitment to politics, to governance, to public policy, and to decision-making to the Honorable Chamber in the Senate, and I take this opportunity to welcome Dr. Christina Hines to the Senate Chamber on behalf of the Government of Barbados.
Senator Cummins. Senator Nurse.
Thank you, Mr. President. I, too, join with the leader of government business in welcoming, on behalf of the other independent senators, welcoming the two new senators. We have one here this morning, Senator Hines. And we have some connections. In the sense that we have been educated at a school in Waterford. And I feel very proud, therefore, to be welcoming a fellow of that institution. I believe that Senator Hines comes with a lot of goodwill, and we certainly expect that she will be an outstanding addition to the voice in the Senate, and I look forward to hearing her contributions as we debate several matters over these sessions. So, Senator Hines, welcome.
Thank you very much, Senator Nurse. I, too, join in warmly welcoming you to the Honourable the Senate, Senator Dr. Hines. We look forward to your perspective It will both be youthful and useful. And based on what we know of your work in academia as well as in social activism, very public areas, we should be in for a very interesting set of perspectives and contributions to the work of the Senate. Our role as legislators is to pass laws for the good government of Barbados, as outlined in the Constitution, and the richness and diversity of experience and expertise which is available in the Honourable the Senate adds richly to the proceedings which come to us from the Honourable House of Assembly. As indicated to you, like unofficial welcome privately, feel free to draw on the resources of the clerks at the table. There are our experts in parliamentary process, rules of order, history, use of library resources, and you will find them, as well as your fellow senators, to be quite useful. I'm here to assist in any way that I can, and I look forward to working with you as we advance the interests of Barbados through our work in the legislative branch in our triad system under the Barbados Constitution. So thank you for agreeing to serve, Senator Hines, Senator Dr. Hines, and we welcome you. Dr. Hines. Senator Dr. Hines.
Good morning. Thank you, Mr. President. Thank you all for making me feel so welcome here today. I truly feel very welcome. It is a privilege and an honor to be here among all of you. It is a privilege because there are many people who could have done this and who could have done this excellently. So I am humbled to have been selected from among the many talented Barbadians that could have done this. I hope to bring my many experiences as a political scientist, a researcher, an educator to bear on our work in this place. Mr. President, I also would like to say that I come here as myself, the only way that I can, which is as myself, but I do not come here for myself. I come here to do the very best for our country, Barbados. Thank you so much for welcoming me.
Announcements by Your Honour.
I received the minutes of our meeting held on Wednesday, March 16, 2022, and Monday, March 28, 2022 for confirmation. Senator Cummings.
Mr. President, I beg to move that the minutes be adopted by this Honourable Chamber.
The question is that the minutes so cited be confirmed. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it. Minutes, therefore, of March 16th and March 28th are confirmed.
Presentation of petitions, presentation of papers.
Senator Cummings.
Mr. President, I'm commanded to lay the following documents in the Chamber: the Barbados Prison Service Annual Report for 2020 and the Police Complaints Authority Annual Report also for the year 2020.
Reports from select committees. Questions to ministers. Request for leave to move the adjournment of the Senate on matters of urgent public importance. Statements by ministers or parliamentary secretaries. Personal explanations. Motions relating to the business of sitting of the Senate are moved by a minister.
Senator Cummings. Any motion? No motion.
Standing order 45.
Thank you, Mr. President. I beg to move the suspension of Standing Order 45-2 for the remainder of today's sitting.
The question is that Standing Order 45-2 be suspended for the remainder of today's sitting. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it. Standing order therefore stands suspended for the remainder of today's sitting.
Introduction of bills. First reading. First.
Senator Cummings.
Mr. President, I beg to move the first reading of the Queen Elizabeth Hospital Amendment Bill 2022. Notice of this bill was given on the 20th of April 2022, and I beg to move the first reading today.
The question is that the bill so cited be read the first time. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Mr. President, order number 2 in the name of the Honorable Leader of the Senate. This bill is being assigned to move the second reading of the Queen Elizabeth Hospital Amendment Bill 2022.
Senator Dr. Monroe-Knight.
Mr. President, thank you so very much for allowing me to stand and speak to this bill, the QEH Hospital Amendment. Essentially, is to alter the constitution of the board. But, Mr. President, before I get there, I hope that you would allow me just a small digression. I want, in the context of this amendment, I believe that it is fitting to recognize and to congratulate the thousands upon thousands of frontline workers that this government would have conferred national awards over the last weekend, National Heroes Day. Mr. President, I believe that in the context, as I said, of this amendment for the QEH, that many of those frontline workers would have been healthcare workers in the QEH system, working across polyclinics, working at the Harrison Center, and I believe that it is fitting that we recognize, congratulate them for their work and their continued work and service to the cause, Mr. President. I thank you. Mr. President, this bill essentially is to alter the constitution of the QEH board. Currently, that board stands at 13, and this amendment will move the constitution of that QEH board to 15 members, Mr. President. Mr. President, as we move, particularly in the context of our healthcare system, to make it fit for purpose, it is incumbent upon us that we address the issue, first of all, of leadership. Leadership of any institution sets the tone, sets the manner, sets the agenda for how that institution will run and evolve. Not only to address the concerns and issues of today, Mr. President, but also to look forward, to be able to anticipate issues and challenges for that institution. And in the context of the QEH, and I think many of us would recognize that certainly if we look at the COVID-19 pandemic, we could not have anticipated the mammoth task that would have been ahead of us as a country, but have faced our healthcare sector in trying to address this issue. And in that context, it is extremely important that the QEH ensures that it has at its disposal all of the necessary skills and human resources that would be critical to ensuring that it can meet the challenge, that it can respond adequately to challenges, as I said before, that are current and challenges that are to come. We must appreciate that we need to be able, in the context of leadership, to draw on a wide variety of skills, Mr. President. The current Act makes provision for the QEH Management Board to be made up of persons with a wide variety of skills, including accounts, IT, that's information technology, human resources, industrial relations, engineering, nursing, etc. Because it is recognized that it is not just only those with healthcare skills that are important to the management of the QEH, but that we need to bring together a cadre of persons with a wide variety of skill sets that can contribute to the growth and development of the QEH. And in that context, this amendment seeks to ensure that, as I said before, the QEH will have just that, all of the necessary skills in order to be able to meet the challenge. I want to also indicate, Mr. President, that one of the very, very important additions to the board is that of a trade union representative. The government essentially has done a course correct, Mr. President. We recognize that there was an absence of a trade union representative, and in the context of this amendment, we have ensured that we have moved to include that level of representation that was previously missing, and importantly so. And I want, Mr. President, to address the elephant in the room, because I think that we are all aware that in the context of the healthcare system, and particularly the QEH, that the government and the trade unions movement have knocked heads at some point in time. And the fact that we have moved to ensure that in the context of this amendment that we have a trade union representative is testament to the fact that we are not bringing together an amalgam of persons just to be able to sing kumbaya and to say yes, but that we understand that it's important to have all voices contend in the context of the improvement of our healthcare system. That we are not mindful to run away from the challenge, but rather embrace the challenge, recognizing the need to ensure that all of the key players and stakeholders are represented. And what will that representation do, Mr. President? Again, I am going to be very frontal in terms of addressing some of the issues. I think that we are all aware that there is much to be done in the context of our healthcare system and in the context of the QEH. There's no one that can say that all is well. There's no one that can say that there's no work to be done in the context of the QEH. But we must start somewhere. And this government has done quite a bit in order to be able to bring the change that is needed. But very often, Mr. President, we fail to appreciate that reform and substantive reform that is needed is not a sprint. It is often a marathon. And in that context, as this amendment seeks to address the issue of leadership and making sure that from that very highest place in the context of management, that we have the correct group of people brought together. We also have placed that along with other incremental changes that we are also doing. The issue of staffing shortage, Mr. President, has been one, again, that has been well ventilated, and again, this government has not run away from the issue. At the onset of the COVID-19 pandemic, the government moved very swiftly to ensure that along with our neighbors in Cuba, that we would have nurses here in order to be able to make sure that we could offer the highest care that is needed. Further, Mr. President, we would also recall that quite recently, the government, in collaboration with the government of Ghana, moved to recruit some 65 nurses, and our Prime Minister, in the context of the 65th anniversary of independence of Ghana, indicated that we will make arrangements to have another allotment of nurses coming to Barbados in order to be able to supplement the shortage. We are making changes at the leadership level, but also as well seeking to ensure that we address some of the other fundamental issues that are plaguing our healthcare system. I also, Mr. President, want us to be reminded that quite recently as well, the Honourable Minister of Health, Minister Gideon Edgell, also announced the reinstatement of stipends for student nurses. Also as well, Mr. President, intended to correct a deficit by reinstating these stipends that were taken away some 8 years ago. It is a marathon that we are running, Mr. President. And therefore, as we look at this amendment, we are talking about reform in the context of increasing efficiency, increasing good management, ensuring that we will be able to have the services that are needed in order to make the QEH a more efficient, and I used the word before, Mr. President, fit for purpose. An organization that is fit for purpose, Mr. President, is one who has a clearly articulated vision for the organization. An organization that is fit for purpose, Mr. President, is one who is able to identify what are the key challenges of the organization. An organization that is fit for purpose is also one that is reflective. And in the context of this amendment, we have not only, as I indicated, Mr. President, an amendment that allows us to increase the board to make sure that we have all the requisite skills, but also as well allows for the flexibility of the Honourable Minister to be able to make administrative changes, again, to respond in the context of challenges that arise. And that is also critical. Again, I point to the COVID-19 pandemic. This was not on the horizon. This was not envisioned. And even when the COVID-19 pandemic started, certainly none of us would think that we would still be here at this time. And that pointed us to a need to ensure that we have within our healthcare system the flexibility that is necessary for us to be able to step back, reflect, and then act, Mr. President. Because we ought not to be stymied in terms of making sure that our institutions can respond adequately by being hamstrung. And so that this amendment allows the minister so that when he is confronted with a particular challenge, that he is able to make sure that he can bring alongside in the context of management and leadership also those requisite skills. And those skills, Mr. President, are not going to be stagnant. They are going to change as the circumstances change. What we need now in this context may not be what we need 5 or 10 years, or maybe even tomorrow, Mr. President, depending on the particular circumstance. So that this amendment, in allowing the Honourable Minister to have the flexibility to be able to adapt, again, is contributing to that, what I said before, of making the institution fit for purpose. Mr. President, I want to also speak to, again, very, very, very frontally, some of the other issues that are plaguing our healthcare system, and that good management in the context of leadership that would come from a board that is established to set policy for the organization can then help us to be able to confront. We would know, Mr. President, that there has been much angst in relation to the delivery of some critical services for our population within the healthcare, within the QEH and the healthcare system. We note, Mr. President, again, that right now we have had a COVID-19 outbreak at the hospital. Mr. President, I am confronting the issues very frankly, yeah? But the only way that we will be able to adequately address those issues is by, one, acknowledging that they exist and then also making sure that we have the right protocols and systems to be put in place in order to be able to address these issues and to be able to confront them. And Mr. President, I do want to indicate that one of the things about addressing and confronting issues is also, as well, as I said before, by making sure that we have all of the voices that are going to be at the table and allowing them to be able to contend and input into the process. One of the things about this amendment, and one of the things when I look at the construction of the QEH board and what is intended to do, it is that it's intended, Mr. President, to bring voices from different places to the table so that we can be assured as citizens that our concerns do not only have to be fueled in through the calling program by which we like to use, but that we can have representatives on that board that can speak to the issues as we would want to as citizens, that can put solutions to the challenges that confront the healthcare system, that can speak to the healthcare system and to speak to addressing those issues in a way that humanizes the process. Because very often we can speak about institutions and functions, but not necessarily to the end that they serve, which is people and people's health, Mr. President. The healthcare system and the QEH in Barbados is an institution that is intended to make sure that we have a healthy population, which is also critical to our growth and development. So it stands as a critical, and I cannot overemphasize how critical ensuring that our healthcare system is cemented, that our healthcare system is fortified, and its contribution to the downstream human development of this nation. So that the issues that we face in our healthcare system are not just issues of health, they are issues of growth, there are issues of development, there are issues that are about families and livelihoods, Mr. President. There are issues about women and children and men. If I don't say and men, then I may be accused of being gendered, but there are issues for everyone, Mr. President. And therefore, the importance, and we may see this as just another amendment, and something that we should, pass and pass quickly, and I hope that we would do it because it is important. But I want to again reiterate that the context of the discussion around our healthcare system and making sure that it is well run and well functioned is something that we have to make sure that we see the importance of, that we are fully apprised of, Mr. President. And I want to again also as well congratulate the foresight of the Honorable Minister of Health for being able to look at what was happening in the context of the management and being able to say, we need to have more. Yeah? He could have taken a position that says, let this run the course. We will be satisfied with what we have because this is what it is. But this government is not one to be satisfied with the status quo. It is not one to be satisfied with just simply staying the course. But again, because we understand the very fundamental role, Mr. President, of our healthcare system, and the fact that we have made a commitment to the Barbadian public about delivering the highest quality health care to them, that we will continue on that marathon that we have started. Continue on that marathon, Mr. President, to ensure that we continually relook, that we continually step back, we continually reflect as much as we can. In order to deliver the best quality healthcare, Mr. President. Mr. President, before I take my seat, I want to also finally say as well that in the context of a discussion about the QEH, about a discussion about our healthcare system, that as I said before, we look not only to the current challenges. I think that, and I'm not, again, like I said, shying away from that discussion because I think that's an important one, and I've said I've been very frontal in terms of looking at the issues that we have to be able to confront and to be able to address those issues. Those are well ventilated in the public, and the government is committed there. But, Mr. President, I also want us to cast our eyes 10 years down the line, 20 years down the line, in terms of envisioning what our healthcare system should look like at that time. Because if we only focus now on just the current challenges, if we only focus now on what is in front of us, we will risk, Mr. President, the opportunity to begin to build forward. We will risk, Mr. President, not being able to cast our eyes upwards in order to envision a healthcare system that can meet the needs of future generations. And again, this amendment allows us to be able to do that. It allows us to be able, at the same time as we address the current, to also as well make sure that we have a system and a process that allows us to be nimble enough, flexible enough to be able to make sure that we cast our eyes and our vision forward in terms of building the healthcare system that would help this country and its citizens be propelled into a nation that is healthy and that is sustainable. Mr. President, I thank you. Mr. President, I beg to move that this bill be read a second time.
Thank you, Senator Dr. Monroe Knight. Senator Dr. Crystal Haynes.
Thank you, Mr. President, for recognizing me. I will open by saying that Barbados, we don't have a lot of natural resources. We've heard that we have oil offshore, but as far as we know, that's a limited amount. We have no gold, no diamonds. It's always said that our greatest resource is our people. And we can extrapolate from that, that the care of those people would be the highest level of public service. I might be biased as a doctor, but that's a hill I'm willing to die on. The island's only tertiary care hospital is the QEH, and it is one that has been able to proudly deliver service from the most simple procedures right up to kidney transplants over the last 58 years. Thank you. We have a privilege in this country whereby we know that we can walk into any polyclinic, we can walk into the QEH, and know that at the end of the day, we will not have to foot the bill because it comes from the public purse. Even so, it's even a greater privilege because we also, when we look at the WHO data, what we can see is that half of the world's population don't have access to the health care that they need. Further to that, 100 million people annually are actually pushed into poverty because of out-of-pocket health care expenses. In 2002, the QEH Act of 1966 was repealed and the Health Services Regulations of 1977 were repealed, and a new act came into place which established a new board, a QEH board for the first time. This was done at the time because clearly over time there's a need to evolve as the needs of the population changes. I've been a physician for 12 years, and between medical training and actually going through the ranks from intern to senior health officer to registrar at the QEH, I have a level of familiarity with the institution, probably only surpassed by one other person in this chamber. There have been numerous complaints, and a lot of the challenges have been identified by the previous speaker. A quick listen on any program or opening the paper on any given day, you can see a litany of woes coming out of the institution. But what we have to understand is that the hospital that was established in 1964 was not built to meet the needs of today. And what this new board will have to do is to ensure that the QEH is positioned for the needs of the population and the challenges that will be emerging in the future. The bed capacity at opening in 1964 was 464 beds. Since that time, in 58 years, our bed count has increased only by 90, while the general population has increased by 70,000 people. Annually, there's been a doubling of the throughput in admissions to the QEH. So what is clear there is that you have an outstripping of the established resources based on the needs of the population. The toll is not just in relation to the physical plant, but the toll is also on our human resources. Many times you talk to any doctor or any nurse, and you're going to hear complaints of burnout, having to work long hours, doubling up on shifts, and so on. So while we seek to position the hospital for the future, we can't neglect, while we talk about capital expenditure planning and so on, to also ensure that we are taking care of the needs of our staffing community. Because ultimately, the care that patients receive is based on the care that can be given based on where our staff are. The old board was able to accomplish a number of achievements that the new board is fortunate to be in a position to build on. I just wanted to spend some time going through some of the accomplishments because many of them have not been ventilated in the public domain. Many are familiar with the establishment of the new accident emergency expansion project, with phase 1 and phase 2 already being completed. There's been the appointment of a number of temporary staff, including 49 Ghanaian nurses. There's been the establishment of 2 oxygen plants and medical air plants as well, repairing of the roof at the SICU and of the recovery room, both of which were damaged extensively during Hurricane Elsa. Those repairs have been completed. There's been refurbishment to the nurses' lounge. Overall, an $18 million capital equipment investment has been made, which has seen the purchase of a new operating microscope for neurosurgery and for ENT. We've seen, through philanthropic donations, renovations of Ward B8, the donation of a new CT scan to the accident emergency through the Maria Holder Memorial Trust, and the implementation of an automated inventory management system. The new board, like I said earlier, will be tasked with positioning the QEH for the future. And this can only be done, first of all, by identifying what the current state of play is, what the existing needs are, and making decisions based on evidence. One of the priorities is that there's going to be a new information management system funded by the European Investment Bank that will actually allow us to be able to mine data where we can examine issues related to long wait times, how long are patients waiting to be seen in clinic, why are people being rescheduled, how often are we seeing cancellations, and thereby we be able to extract data on which to make decisions for the future. Healthcare comes at a cost, even though it does not, although you're not presented with a bill as you exit the hospital. And one of the other things that we will have to look at in time is a sustainable financing model. My presentation is not coming out. right? One of the things that we also want to look at is dealing with our NCD challenges frontally. We can try to do that through the expansion of our community health program. Right now, we have over 550 patients under the care of a public health doctor, public health nurse, and over 40 community liaison officers. And, Mr. President, I'm obliged. Thank you.
Thank you very much, Senator Dr. Hayes. Senator Mr. Miller.
Thank you, Mr. President. Mr. President, I would like to be brief when I speak about our venerable institution and I am sure that all of us at some point in time, if you have not already been there as a patient from birth, might end up there. And we all have a vested interest, or we should all have a vested interest as citizens in making sure that while we can in public speak of the ills, we should also speak, Mr. President, of the positives, because it's easy to break things down and very hard to build them back. Now, Mr. President, I spoke some time ago in this chamber with my own mantra that said, there is no good time, there's no right time to do the wrong thing. And I repeated it. Mr. President, if we speak to leadership in an institution which has a long history of existence, and we wish to see it continue that way, we must be honest in how we hire our senior staff. And there are accusations within the institution of nepotism, and I'll leave it there. But we must not, Mr. President, do things that might leave the institution in a position where there's embarrassment that spreads back to those who are ultimately in charge, like the minister. Mr. President, the hospital has benefited, yes, from the money spent in the COVID-19 pandemic, and some of the things that existed before have been restored. Like the hospital has always had 2 oxygen plants, and the Honorable Prime Minister, in the very early stages of the pandemic, took advice and provided the financing to acquire and repair or replace the existing plants. And the country will benefit significantly from having them. The pandemic has also provided an opportunity, Mr. President, to reorganize some of our services. And one of the positives that has come out is that the pharmacy, that was what I call a stand-up, line-up, wait forever pharmacy, has changed significantly. And patients can now, for a small fee, have their prescriptions delivered. And I think that's a major, major achievement which must be applauded, Mr. President. And that is open to every patient who comes through the QEH. So we should not have the issue of having people waiting all day and having to leave work to collect a prescription when you can probably spend a tiny fraction, I think it's under $15 of your pay for the day to have it delivered. Now, one of the biggest problems the QEH faces, Mr. President, is nursing shortages. And I've stood in this chamber and many other persons and spoken about the nursing problems in terms of staffing. And yes, the government has made an effort to continue what has been happening for many years of seeking nurses from overseas. But it's not enough. our nurses leave probably at the same rate as the replacements come in, Mr. President. And they go to greener pastures. And I have asked, why do they leave? Why do they leave this beautiful Barbados that we speak so much of and we spend all the time building out? They leave, Mr. President, because they're unhappy. People who are very happy in their environment and in their jobs and their ability to earn and move on and to acquire a mortgage and to raise children do not usually leave. And I asked whether we're doing enough for our nurses. And yesterday, Mr. President, in our hospital, our operating lists were hampered because we did not have enough nurses to keep all the operating rooms open for the afternoon session. And nurses did double shifts. But there's no award for them. And they do it repeatedly. And there's burnout, Mr. President. And I do not know how long it can continue. But on the other hand, when we ask, what do we do to keep the nurses happy or improve the conditions of service, there's silence. Yes, the government has made strides to increase the number of young nurses coming in by making changes at the community college level and trying to make sure that the areas in which people were probably failing have been corrected. And in terms of education, that is important. And there is some easing of hardships by providing the stipend which was previously provided to nursing students. But once you're qualified, and most nurses are female, and the vast majority at some point in time will bear children, have all the difficulties of working as a professional and having to provide childcare outside of what a mother does and have to pay for it or have to make arrangements when they work extra hours. And we have constantly asked, why is it that no government has seen it fit to do anything to provide childcare services specifically for the nurses at the QEH? $500 a person, Mr. President, could provide a lot of money to do such. And I'm not being critical, I'm being practical. Mr. President, we could build out all the new accident emergency departments and everything else. And if we do not fix the problem of nurses, we will have nice, empty buildings. We have to devote some time to fixing the problems of nursing. We have to do the things that are necessary to allow the nurses who work in Barbados to feel happy and want to stay here, Mr. President. Now, Mr. President, the government has correctly moved to green Barbados with alternative energy, but we keep committing the same offenses in broad and clear eyesight. Now, I took a photograph a few weeks ago of a large roof covered in photovoltaic panels, and I'm sure the meters to Light and Power were reversing as we were selling power back to the grid. But right next to it was an incinerator billowing out large amounts of black, acrid smoke. And I asked myself, how are we greening Barbados if we're doing this? But this problem of the incinerator, this scourge, Mr. President, that is inflicted on the persons to the west of the QH is not new. It has gone on for many, many years and many administrations. And no one seems to be able to provide a long-term, permanent fix. And I hope that the ministry under the new minister, will find an answer, because it is a terrible thing, Mr. President, and we need to fix it. But we can't be, on one hand, looking after people who fall ill, and potentially, on the other hand, contributing to the illnesses. The problem of supplies in the QH, Mr. President, continues to be a problem, but there's no place in the world delivering medical care that does not have a problem with supplies. Some of it existed before the pandemic and has been made worse by the pandemic, and some of it, Mr. President, simply happens. Now, over 3 years ago, the hospital made a decision to do a complete audit of its inventory. And the supply chain to the hospital was shut down. And it created major problems with the suppliers, especially right after that, when the debt restructuring was done, and the overseas suppliers were not paid. And there was one supplier who provided radioactive materials, specifically radioactive iodine, to treat cancer patients, thyroid cancer patients, and to do investigations, was not paid. And they shut off all supplies. And it took the hospital over 3 years to get those supplies back. And it only happened in the last few weeks. I guess, Mr. President, one would wish to congratulate the hospital on finally getting it back. But for all those persons who could not afford to go overseas to pay to have radioactive iodine treatment, who had cancer, they have had to wait 3 years to get their treatment. But only those who could not pay. And that's what happens when bad decisions are made at the top. So there is no good time, Mr. President, to do the wrong thing. Now, as I drove from the QH this morning, having done more rounds to this chamber, Mr. President, to the yard and then to this chamber, Mr. President, I saw several elderly people slowly and painfully making their way down the road, and some crossing the street. And to me, it was obvious that they had joint problems. And we've now reached a stage in this country where the only persons who can have a joint replacement are those who can pay. I'll repeat that. The only people who have their joints replaced are those who can pay. But Mr. President, back in the early 90s, the first total joint replacement was done in the north of the island at St. Joseph Hospital. And later on, the same surgeons moved it into the QEH. And it has died. And you have to ask, why has it died? It's died only in the public sector. It is alive and thriving in the private sector, Mr. President. So the only people who get joint replacements done are those who can pay. And I believe that all the elderly people who have creaky knees and painful hips, they too deserve to have theirs fixed if they're capable of being fixed. And maybe and clearly we have the technical skills, because the hospital hires, I believe, only the best people as consultants. So there should be no problem with the consultants in the hospital being able to fix joints. So the problem has to be, to my mind, a problem of supply of joints. And there's some things that can be fixed from the government side, and some that can be fixed from donations. And I believe, Mr. President, that if the will existed, the joint replacement program that used to exist in the QEH, that fixed the joints of those who could not afford to pay for it, could be restored. And I would like to stand one day soon, Mr. President, in this chamber and speak positively about the people, Mr. President, and probably quote numbers who've had their joints replaced and repaired, and they can be functional in their own houses, Mr. President, and outside. Now, Mr. President, our hospital used to earn somewhere in the region at its peak about $12 million a year, a significant sum of money. And that has now been reduced to around 3 million, thereabouts. And the earnings of the hospital are dependent on private care, whether they get a CAT scan and pay for it, whether they get blood work done in the lab, whether they come and have a major surgery or a medical event. But the people who admit those patients to the hospital or bring them to the hospital are the consultants in the hospital. But over the years, private care has been moved from the hospital into the other institutions that have grown since then. So now we have a different skew in terms of the percentage of people who pay for private care and those who seek public care. And certainly there is a reduction in the number of people who traverse the QEH's doors to seek private care. It's down to a minimum. If the government is going to invest significant and large sums of money, or continue to do it, into the infrastructure in the QEH, there has to be some return on the investment. And we have to find avenues of encouraging my colleagues and others to use the facilities for private care. Because there's no doubt that there are times in this country when it doesn't matter where you were, you have to come to the QEH. And if we allow it to fall apart, when we ourselves need it, it will not be there. And don't believe that you can always get in an air ambulance. There are times when you're too ill to fly. Now, Mr. President, there's a lot of development going on in medicine, and there are reasons why, there are social reasons why the hospital may appear to be crowded all the time. We have an Asian population. I can't believe that I'm the age I am. And I suppose, the President, neither can you. It just, a former president, sir, in the Senate is alleged to have said that you get old really fast, and it's true. Mr. President, we have to make sure that as we age and as the young people come up who need care, the facilities are there for them to have a choice, whether they want to have it as a non-fee paying patient out of pocket or as a fee paying patient with insurance or however they choose to pay it. So there has to be some level of cooperation and coordination between development in the private sector and the public sector. And sir, while I listen to the Honorable Prime Minister speak in another place, I think it was the 26th of last month, and I listened to her 3 times because I thought that the presentation was brilliant. But if those things could be achieved, Mr. President, we wouldn't need anything else. It would be absolutely fantastic. If you get 10%, we're still doing very, very, very well. When we spend money, Mr. President, in healthcare, we have to have some way of assessing the outcomes. So if you spend $100 million on healthcare, there has to be some way of assessing outcomes. It just can't be that, yes, you spend $100 million, but it made no difference. It has to be directed. So there has to be serious coordination between those who plan in the ministry and those who institute and hire at ground level. Mr. President, I'm going to close, but I want to make one final statement. The government has spent large sums of money on the partial rebuilding and the expansion of the Accident Emergency Department. And regrettably, Mr. President, I stood in this chamber and I said that if it was not done in a particular way, we will create a very nice place to wait. And unfortunately, that is happening. We have not solved the problems of flow in the institution. And some are old and some are new. And I heard this morning that there were outbreaks of COVID in the hospital, and that is true. And whenever that happens, it means those beds come out of service and people have to wait longer with all the attendant problems that it causes. The COVID-19 pandemic will not be here forever, and it will go. But Mr. President, one of the problems that happens from June on, whenever the hurricane season starts, whether it starts in June or not, is that there's always this fear about flooding in the critical part in the QEH and storm surge. And we've done a beautiful expansion and development of the Constitution River. There are days when I am on the third floor and I think, if I only had a little canoe, I would row that river up and down. It might still happen. But I look at it, Mr. President, and I think, when we do get hit with a serious hurricane, what will happen? I haven't seen any information that will tell me what will happen, but I worry about our Accident Emergency Department that we've spent so much money on. And I worry, really, if there is storm surge, will it be safe? I hope that it will not be a problem. And I hope that when this hurricane season starts, and if unfortunately we expect bad weather, we will not have to evacuate it as we've always done because of the risk of storm surge. Mr. President, the development of healthcare in Barbados, and I'm not, Mr. President, anticipating as defined in the standing orders, the development of healthcare has to be integrated, and the parties who have the money to put into private care and private development have to have discussions with government about what they're doing. Otherwise, we duplicate services and become uncompetitive. And I hope that whenever the institutions in the north are redeveloped and reopened, that will be part, really and genuinely part of a national health plan. And the newer ones and the newer services that are to be provided will be open to all. And not only those who can pay, Mr. President, because we cannot be a destination where we provide the best care for those who can pay, but for those who live here and who can't pay directly, they have a second-class service. I thank you, Mr. President.
Thank you very much, Senator Mr. Maynard. Senator John King.
Thank you, Mr. President. I want to start by asking members here, and for those on the outside who may be listening, to stop for a minute and to think about what we have been able to accomplish with the QEH in spite of all of the other things that have been going on around us. Oftentimes, you can listen to the radio programs or you can listen to people on the street and we complain. And we can speak eloquently about all of the problems of the QEH. And I think one of the members alluded to the fact that we also have to find time to bring some sort of balance to this particular conversation, especially when healthcare in numerous places across the world is not free. It's not free by any stretch of the imagination. And we have, as I said earlier, against all odds, been able to maintain this as a free service to our people. And so therefore, starting from that particular point, when I look at the proposed amendments in terms of, for instance, bringing on other skills that are needed to expand and to improve on the delivery of service for the general public, I think we are going in the right direction. Although at the same time, I'm a bit peeved and perturbed that it would have taken us this long to get to these particular points. Now, I have stayed away from the QEH, not for any reasons other than I like to take care of myself. And I have not had any real reasons to go in there for any medical treatment or anything. So I can't speak honestly about what type of...
has been repealed. Those in this environment will be aware of how quickly things happen. But most attorneys, when they go, they're gonna go to the laws of Barbados in hard form. If you get somebody who's been amending, I don't even know if they still amend with paper. You might go to the Consolidated Index. You might go online, which may not be accurate. You might get access to Parliament. But on Parliament website, you do the legislation, and then for amendments, you need to go to the section that says bills and resolutions. Now, for me, my question would always be, when I look at bills and resolutions, is that what was actually passed since it went to Senate? If what is online is the final version. Now, I have been told it is, but there's always this doubt because a bill, at the end of the day, is not the act. But I digress, sir. I'm just making the point. We really do need to be doing better for those of us who are ultimately asked to review legislation and speak to amendments. It is way overdue. All right, so Principal Act, back in 2002, at Section 5, subsection 3, states, and I quote, "The members of the board shall, A, possess the expertise, business acumen, professionalism, and experience that would allow for the proper discharge of their functions. B, be individuals who have demonstrated, 1, competence and outstanding achievement in their field of endeavor, and 2, commitment to community or public service." And that was subsection 3 of the section in the Act that spoke to the establishment of board. And the reason I cited that today is because you're going to see that subsequent amendments make reference to this section 5.3, even though it is not set out in detail. So of course, when you're looking at an amendment, you've got to tap back to the Principal Act so you can put things in context. In 2019, sir, the government of the day, oh wait, it's this one, wait. The current government went further, saw it fit to take section 5.3 and put some meat to it. So we had section 5 paragraph, I beg your pardon, in the schedule. Paragraph 1.1 became, the board shall consist of 13 members who shall be appointed by the minister by instrument in writing. The current proposed amendment is simply taking that to 15. Okay, that's fine. But the 2019 Act under the government went on to a paragraph 1.4 that stated, the members of the board to be appointed under subparagraph 1 shall, in addition to the executive chairman, comprise A, the permanent secretary, Minister of Health, ex officio, or the nominee of that person. B, the chief medical officer, ex officio, or the nominee of that officer. So that's 2 people so far on the board. No, 3 people. We have the executive chairman, permanent secretary, chief medical officer. Then it says, persons who possess the qualifications set out in section 5.3, which I just read, in relation to the following disciplines: accounting, 4, engineering, 5, finance, 6, human resource management and industrial relations, 7, information technology, 8, law, 9, management operations, 10, medicine, 11, nursing, 12, and paramedical services, 13. So the legislation, by virtue of its schedule, not only said we're going to appoint 13, it brought down the types of persons that you want in terms of their background, expertise, and knowledge. So when I saw the proposed amendment for today, where the increase went from 13 to 15, I wondered out loud, how come the government didn't amend paragraph 1.4? Because the only amendment is paragraph 1.1. So everything else that was passed for the 2019 legislation remains the same. The trouble is that the current wording, reading of paragraph 1.4 addresses 13 people. Now, there's provision for, I suppose, you could have 2 in accounts and 2 in engineering, enough in industrial relations or labor. But for me, for purposes of completeness, and for the way that I understand legislation should be dealt with, you need to be consistent, you need to be clear, and you ought not to be vague. If you saw it fit to not only identify 13 persons, but to go on and list 13 persons, why wasn't it done for the additional 2? Now, you can say the power that you're trying to give to the minister by virtue of the, other amendment that allows for him to amend the schedules. The minister may by order amend the schedules. And paragraph 2, and an order made under subsection 1 is subject to negative resolution. That's all well and good, see, but when a minister makes that type of order, provided that it is gazetted properly and in a timely manner, you then have 40 days to say if you have a problem with it. The thing is, though, if you don't know what's going on, an order can be made and passed that is detrimental to a particular individual or particular group of persons, and it is missed because it's done that way. If you are changing the numbers, why didn't you change paragraph 2? Is it that you didn't see it, you missed it, you didn't pick it up? Is it that you're going to amend it by bringing another amendment? The problem with all these amendments that we're doing is that we are sadly in a state, Mr. President, where we don't know what the law is in some areas because the amendments are happening furiously all the time. There's no opportunity to pull them together. For today, from 2002 There was a 2019, a 2020, and now we're having another 2022. Same act. And these are one or two. What happens if there are lots of them? You lose track. The Road Traffic Act, as far as I'm concerned, is a complete mess. If we don't have a consolidation, that's the word that Mr. Jones helped me with a few years ago, something wrong. We need to do better in terms of when we're doing amendments. It can't be that somebody wake up in the morning saying, get a vax, let's go to 15. And then nobody pays proper attention to what should come with that, so that we have a holistic and an efficient amendment. It is not reasonable that you have to be dealing with matters, and you've got to remember, well, you need this for this point, this for, no. You have the power to make the amendment. You have the power to manage those who make amendments, those who do the drafting. Take the time to do it properly. That's my position as it relates to the proposed amendment. I also want to know if it's a secret that we are not having an amendment to know who what area the two new persons are supposed to be bringing to the board. It can't be a secret, though, not with this government, because this government speaks on a daily basis, almost, about transparency. And in that regard, what we have expected, having taken the time, this is not the other administration's legislation, this is this government's legislation that itemized all 13. The 2002 Act had numbers too, but they were not itemized to line up with the 13. So if you did it 2 years ago, 3 years ago, why didn't you do it with this one? This is your legislation. So what's the problem? And those of us who have to represent the interests of individuals have the right to know the way the law stands in a way that is manageable. Because if I have to represent somebody and I need to know if their rights have been infringed by virtue of what has been done to them, I should be able to go to the legislation that deals with the composition of the board to be able to see what's going on. Do it better. Be more organized. Be more structured. Piecemeal is not making a lot of sense, and it's not necessary. I don't think it is necessary. You have the time, you want the amendment, look beyond what you are asking for and make sure that none of the other subparagraphs, there's 2, 3, 4, 5, 6. And to my mind, the one that would have been most connected to the proposed amendment would be the one that makes up the composition of the board. It is tedious how we are making amendments. And if my point is taken by some slim chance, that's another amendment. So we will have Queen Elizabeth Hospital Amendment 2002. Then we will have Queen Elizabeth Hospital Amendment Queen Elizabeth Hospital Amendment Act 2002-1. Then another one later this year, Queen Elizabeth Hospital Amendment Act 2003. And sometimes we go all the way up to 6 and 7 because there's piecemeal amending going on. It's not conducive to the smooth operation of how you do business and how you flow. This is the law. Let it make sense. Let it make sense. All right. Mr. President, as I look at the other amendment, the minister may by order amend the schedules, and an order is subject to negative resolution, as I said. I pray that unlike what seems to be the practice, that it will be properly gazetted, because with the power of negative resolution, time is of the essence. You have a time frame within which to object to anything. And therefore, you need to know not only when the order is made, but from when time starts to run. So I hope that by virtue of adding this, that the powers that be will ensure, especially for legislation that governs the hospital, Because let's talk about the way the hospital is administered at the legislative level and the government level, the cabinet level. The 2002 Act says, at Section 5, subsection 1, there is established a board to be known as the Queen Elizabeth Hospital Board that shall administer and manage the hospital. That has not been amended, so that is still the law. But you know, isn't it interesting that the board is to administer and manage the hospital, and there's no board properly in place yet there? Because it can't be in place yet, can we pass the legislation for it? That's happening today. So that means today, on the 4th or 5th of May, whatever today is, from an election in January, board. Seems a little strange to me. Yes, you have an overriding and overarching Ministry of Health. But how does it take that long to put a board in place that is critical to the administration and management of the hospital? It concerns me. And that is why when you hear certain people in high places who should know better talking about how badly the hospital is being managed, they should bite their tongue. You know why? Because in spite and despite not having a board in place, the hospital is still standing. So that means that the executive chairman and the executive managers have been doing their jobs. So they should not be subjected to people coming into the fray, now come, have not had proper instructions, don't know what's going on yet, and talking about the hospital is so badly managed. It is not fair. Because in light and in spite and despite what people are saying and doing, the hospital is still standing. So if the board is not properly in place, but you have your managers, it means that no matter what improvement you want to make, what changes you want to make, you should still respect the persons who are managing the hospital. You don't have to like them, but they're doing a job to the best of their ability. In an environment where, whether they are abused or not, they can't come and say nothing about nobody. But that ain't fair. When I spoke on this bill in 2019, I objected strenuously that the person who was targeted to be the executive chairman, their name was being bandied about all over the place. That was not fair to that person. We should have been dealing with a bill and the pros and cons of the bill without subjecting the person to abuse and attack. And what she do, and who she married to, and all that. When we are doing things, we have to treat people like human beings. When we are doing things, we have to treat people with respect. If you don't like what they're doing, follow the employment rights procedure. But do not attack people who cannot answer you. You have not even had, you haven't even sat with them to see. You've operated on rumors and all kind of things. But the hospital is still standing. Who ain't doing what they're supposed to do, deal with it, but don't come and abuse people. You improve. I heard the minister responsible for the hospital thanking management, thanking the previous board. Good for her. We need to do better. Nobody is saying that you can't change. Nobody is saying you can't amend. Nobody isn't saying you can bring who you like. I ain't touching nepotism. That's Senator Maynard. But what I'm going to say is, do the right thing. Do the right thing. They're people too. Mr. President, I do hope that the government plans to enlighten the country as to what would be expected of the additional 2 members of the board. And on that note, I seem to recall hearing, I can't say who, but there was a lot of talk about this amendment is to make provision for labor. I'm confused, Mr. President. The amendment of 2019 made provision for a person in the area of industrial relations. What is industrial relations if not labor? You are the government. You have 30 plus. You know what I mean when I say plus, but bring your amendment, bring your explanation, but make it make sense. You cannot come, but you can because you did. Come to people who can read. Who you talking about? You amended for the purpose of labor when there's provision for industrial relations, and the person who has been on that board for a number of years is the head of a trade union group. But you have the majority where you don't even have to give a reason. You could just say we're amending. So don't come and try to, what you're trying to do by coming and talking about, we are adding labor. We need to amend for labor, and there's provision for industrial relations, and the gentleman who represents that represents an entire group. What is that about, Mr. President? That's a query for me. Because if you're suggesting that you need something other than what he's been doing, seems to me that you're disrespecting his contribution to the board, even though he's been on the board for all those years. Seems to me. So, in spite of having industrial relations covered, we still need labor. You're splitting hairs. So that's why I was curious. That started my curiosity. And that's what made not having an amendment to the paragraph that speaks to the Constitution, not having it included in the amendment, that piqued my curiosity even further. Because your reasoning for the amendment was already addressed by who was appointed to the board. Do what you're doing and do it in the open and stop getting on like, you know, you have a secret or you know you're doing something that may not work, so you're trying to think because you know when you talk labor, everybody is, yes, we're for the people, of the people, by the people. But that's clear. We are a one-party state. What more do you need for proof that you are the cat's meow? But don't try to sauce out right-thinking people. That's not necessary. Make your amendment and come along down the road. Be transparent. That's your buzzword. I'm hearing a talk about guest relations at the hospital, a guest relation type of setup. All the best with that. Because I think that's the same thing as they were using something called patient advocates, which the previous board set up. That was a big thing. So it sounded like you're coming with something new, but not quite. That's your thing. It'd be great if everything can improve. You can have improvements like what Senator Maynard referred to. My issue is always, it's not what you do, it's how you do it. So, in closing, Mr. President, 1, please for proper access to the current state of the law, both as it relates to the Principal Act and amendments first. 2, query as to whether you're going to be breaking down the constitution of the board for the information of all. And if you are, even though excuse me, even though I know this is not gonna happen, I'm gonna put it out there. If you're gonna do it, hold a minute, add it to the amendment, and then make the amendment. Don't make the amendment and then come back and make another amendment. You're already into May without the board. The hospital is still standing. If it take another few days, you know what I mean? But don't, and then 3 months from now, another amendment. No, that's tedious, onerous, arduous, especially for those of us who practice law. 3, stop bashing management, man. Stop. Let's not. Doesn't look good as an employer, man. And y'all, you created an entire piece of legislation for an individual. And then you have people coming in as new to the ministry and talking about the mismanagement of the hospital. If you feel so, that's your right, you know. But say it at a board meeting. Don't say it out in the open. Don't do that. That's not fair. Because whoever you bashing can't answer you. And I don't have no brief calling for anybody. It is what is fair. It is what is fair. 4, Mr. President, I will ask the government to kindly do what you're doing, say what you're going to do, but don't try to, and this is me, my opinion, don't try to make it what it is not because you feel it can't happen. Because at the end of the day, if it's something with a simple majority, it can happen. The explanation between industrial relations and labor, if I'm given one, it can't wait. Because at the end of the day, it's one and the same. You're splitting hairs. Bring your amendment and come. If you put it in somebody for guest relations, put. If you put in somebody as a pool attendant, put. If you put it in an area for those persons who used to be in the hotel industry that are now retired or have nothing to do, put. But this was your legislation that itemized the 13. So why didn't you itemize the 15? I'm just asking. With that, Mr. President, I'm obliged to you.
Thank you very much, Senator Tate. Her Honor, Senator Thompson.
Thank you very much, Mr. President. I use the opportunity of this debate to speak from several perspectives. As a Barbadian and therefore a stakeholder with a vested interest in the Queen Elizabeth Hospital and its proper and effective functioning and management and delivery of care, because all of us, whether we have money or not, invariably need to turn to the QEH for care. And it is important as an institution that it should be a flagship institution, a model of care for the Caribbean and for developing countries, but most of all, a quality of care that makes the difference to life and limb of the Barbadians who need it. A quality of service that exemplifies those who work there as persons of the highest standard and caliber professional, who themselves receive through its methods and processes care for themselves. Not, and I don't speak only of, at this time, of healthcare, but care in the context of those who are delivering care and are under pressure from doing so, who feel a sense of burnout and stress, who see pain and suffering close up every day, and therefore themselves need to find some measure of relief and release, where we need to build into the hospital system a structure that cares for the caregivers. I speak as well as a former Minister of Health of Barbados, with whom this process of the transition to a board at the QEH started. Indeed, I would want to pay tribute to some of those persons who sat on the committee that discussed care at the hospital and made the recommendation to transition to a board. Regrettably, I don't remember all of the names at this time. I'm getting older, my memory is getting worse. It has never been good, but it is getting worse, and I'm the first to admit it. But I think that Professor Hassel, I think he is Sir Trevor Hassel, is now the only living member, if my memory serves me correctly, but certainly having passed on would be Sir Richard Haynes and Mr. Wendell McLean. I don't remember the other members. I don't think there were any, but I know that for sure those persons whom I have named served. And if from failing memory I have forgotten anyone who has served and remains alive, I would wish to pay tribute to the work that they did. I'm being prompted that Professor Waldron was on the committee at that time, but that is not my memory at all. But it does not matter. To those who served, I say thank you for their contribution to the process and to the process that yielded the result of the transition to the board, which was an attempt to put in place a more effective, fast response delivery system. Because at the time, part of the challenge that we had was that when the hospital needed supplies, it had to go through what was then called central purchasing. If the hospital needed staff members, it had to go through the Services Commission, or they had to go through Service Commission. And what you would find is that there was no desk in these institutions which prioritized the QEH. So a request came in for medical equipment. It went in the queue with all the other medical equipment, with all of the other equipment and supplies being ordered by government at the time, and the person on the various desks got around to it in due course. And therefore, the idea behind the board was to have a more, and the same thing with staff members. I remember what the process was. A request originated within the hospital. It went from the hospital into the ministry, to the various desks in the ministry. You know what the process was at the time. The chief clerical officer, the various clerical officers, the chief clerical officers, the CMO, the deputy PS, the PS, and from there it would then go to the Ministry of the Civil Service and then to service commissions or whatever. So the process was really quite long and quite complicated. And so the notion of going to a board really was to allow the hospital a higher degree of autonomy to expedite processes and the accessing or acquisition of supplies and materials essential for care, and to be able to recruit rapidly staff when you needed them. That was the thought behind it. And contrary to what was heard prior, there is legislation in effect, and therefore there is a current and valid board in effect. So the notion or the suggestion that there is no board isn't really quite accurate. There is a board because there is legislation that validates the board. The question, therefore, of the composition of the board is one that could and should, in my view, be debated at another time. What really is the ideal composition of a board for the Queen Elizabeth Hospital? Is the structure of a board working? How does it compare with other management systems that exist across the world? Is it the most effective mechanism for affecting care? To what extent does it really have autonomy? Do we have the right cadre of skill sets constituted in order for it to be fit for purpose? And that was the expression that we heard today. I want to, therefore, having made those introductory remarks, indicate that as a Barbadian, like the Honorable Senator King, I myself have not had much use of the hospital. I thank God that I've been in relatively good care, relatively good health. But I have been there with other persons, particularly my mother, who passed in January of this year. And therefore, I have seen close up exceptionally good and exceptionally poor care at QEH. I know what the Honorable Senator Maynard speaks of the quality of the professionals there and what they are capable of delivering when working at their best. And I have equally seen some of the worst of QEH, about which we hear people complain daily on the call-in programs and on the streets with legitimacy. And if we are to be honest, we can say that the hospital really does still have some distance to go if we are to deliver to Barbadians and to the users of the hospital the quality of care of which we would all be proud. A lot of the problems, you can. A lot of the problems there are, in some instances, attitudinal. And they mirror attitudinal challenges that we have seen across the public and private service in Barbados. There's no doubt about that we have a way of treating to each other with a lack of courtesy and a lack of respect. And we do not seem to realize that we are there to serve, and serving means giving high quality service and really treating people with care, not just operating with excellence, and I mean literally operating both in terms of operating as a facility and operating as a doctor, not just doing it with excellence, but really treating the person with a level of respect that makes them feel that they're accessing care and maintaining their dignity at a time when they are most vulnerable. It is important, too, that the quality of care there should be exceptional, so that we should not feel, and Senator Maynard alluded to it in his speech, that it becomes an institution only for poor people and for those who cannot afford high quality service or to pay for high quality service. It must deliver exceptional care exceptionally to all individuals, irrespective of what they can and cannot afford. And there's been talk about nepotism, but there's also talk about conflict of interest in relation to how doctors operate, and let us not dispute these realities. Perhaps I am not intending to elaborate on any of these things today, but to say that let us be frank in relation to the problems that we are facing within the institution on all sides, because it is too important an institution not to have it working at the optimal level. The QEH has been responsible, or certainly has been part of the approach of successive administrations in Barbados to ensure that we build out our human and social capital. The delivery of health care, therefore, has been part of the success of Barbados. Only a couple weeks ago, I was with a group of very well-heeled Black Americans who were in Barbados and were stunned to find out that health care in Barbados is free from primary to tertiary level. And it is something of which we should be proud and which we should try to maintain as a people. I know what it is like, even with health insurance in the United States, to have a problem with a tooth walk into a dentist's office and be told that I had to pay $3,500 up front and then be reimbursed by the insurance company, the institution, the medical facility would be reimbursed by the insurance company, and then I would get my money back. Now, that excluded a whole number of persons, and it isn't just with dental care, it is with all kinds of health care, where people in some of the richest countries in the world are excluded from access to care, from the protection of life and limb, simply because they do not have the cash. And what we are able to do in Barbados, where we deliver a range of services, of health services, of dental services to our people, and the services are generally of very good quality. The outcomes are generally very good, even though you hear some horrific stories. So this is something we have to ensure that we protect the QEH and the outcome of services of care delivery to the average Barbadian. The Honorable Senator Dr. Haynes, in her comments, spoke to the point of the pressure on QEH and the increasing numbers. We have to look at the whole issue of primary care in Barbados and disease prevention. Because when people, with the burgeoning of the chronic non-communicable diseases in Barbados, the stress on the QEH to treat NCDs and all of their sequelae is going to increase exponentially as the NCDs increase. And therefore, we have to go to a form of preventive and intervention that stops people from becoming so ill that they then have to get that level of acute care within the QEH system, because that is where you see the mushrooming of the problem. And therefore, the primary care strengthening is really of extreme importance and requiring urgent intervention and strengthening of our polyclinic system to address the issue of the NCDs. There is too the question of the ratios that need to be met for QEH to remain a well-recognized training institution. We have seen over the years that the number of people doing medicine has increased, but the number of people doing nursing has not. And there was a time, certainly when I was minister, that the fail rate for nurses was very high in terms of the exams. And therefore, we were not able to recruit, get qualified, and place in the institution the number of nurses that we needed to keep the institution going. During that time, we started recruiting from overseas, and I know that there have been various recruitment drives over time. But part of the challenge we have to face is to ask the question, how do we make nursing an attractive profession for young Barbadians? Again, when you speak to young people and you ask them what they want to do, nursing never ranks high on the list. Why is that? And what do we need to change that? There was a time, probably in the 1960s, when nursing was in high demand, when it was considered an honorable profession, when it was considered at a time when many women could not get into medicine, they couldn't get into engineering, they certainly couldn't get into law and so on. Many women opted for nursing as one of the top professions into which they would be accepted. It is not now so for our young women. You will find more women telling you that they are interested in cosmetology and doing hair and nails than in doing nursing. So we have to ensure that nursing again becomes a profession of appeal, because it is an honorable tradition and an honorable profession. And we have in particular, as the profession and the nature of medicine is becoming more complex and healthcare delivery, to continue to try to attract more men into the nursing profession, not just working primarily in the psychiatric hospital, where you tend to see the majority, as far as I'm aware, of male nurses. That brings me to another issue. I was mentioning NCDs just now. And the two things are linked. I was on the hospital compound yesterday. A number of things struck me. That in a country where we have just put on a sweet drink tax, where the primary cause of morbidity and mortality is the chronic non-communicable diseases, all over the hospital there are sweet drink dispensers. More sweet drink dispensers than you can find bottles of water. And as you come out of the main entrance of the hospital, there is somebody with a sign selling gooseberry syrup, guava syrup, all kinds of syrup. And yeah, we are sending mixed signals. And I don't want to put anybody out of work. You hear a lot about how, we attack poor people, and poor people who are trying to do small businesses are not given support. But this is a Queen Elizabeth, it is a hospital compound. So let us not be inconsistent in our messaging. Let us really try to ensure that there are some healthy alternatives given the problem that we have with NCDs. And I was saying that, having been there yesterday, I witnessed that, and there was also something else that I witnessed, and it brings me to my very next point. 15? Great, thank you. It brings me to my next point, and it is the matter of human resource planning within the context of the Queen Elizabeth Hospital. I was there accompanying a friend who has a heart condition. We went to the cardiac suite, and I believe she was having an angiogram or angioplasty or something, I don't know, something heart-related. There were a number of people there. I struck up a conversation with all the people in the waiting area, interesting stories, and one of them whom I knew, memories. We talked about, working together in the same place years ago and so on. We were asked to come at 7:30 or thereabout. An older lady had been there from 7. They started at 8. I want to compliment the nurses. Every nurse who came in said, "Good morning." They greeted us, "How are you?" And they went on about their business. They started promptly at 8 o'clock. At about 8:30, it was drawn to our attention that a radiologist was needed to deliver care on that day, that there is a team, and the team works with a radiologist. The radiologist was not there. So none of the patients who came to be treated on that day could be treated, and therefore people would need another appointment. I locate this not in the context of a criticism, but in the context of the issue of human resources planning for the hospital. What is our vision for a tertiary care institution in Barbados? Let us start with the issue of where is it to be located? Are we going to continue to use the Queen Elizabeth Hospital, which we know is in a flood zone, and in the event of adverse weather, you will have coastal inundation, making it far more difficult to access? So are we going to continue on that site? If so, drainage, because you can engineer these issues. So drainage is going to be a problem that has to be addressed, and I see work being done within close proximity to the Constitution River and so on that will address these issues. But there is enough land owned by government for that whole area to be developed as a health village, so that you have a suite of skills, medical intervention opportunities, etc., all around that location. If you are going to build it out, build it out. So that's the first thing. Location, physical location. of your primary tertiary institution, and what is the physical plan going to look like. We have to move away from ad hoc development, where one minister has a vision for X and another minister has a pet peeve about Y, and so is interested in X. So you see the development as there is a vision of a particular individual. We have to develop a vision plan and a vision statement for the hospital that speaks to long-term development planning and how that planning will be put in place, what skill sets we will need to deliver that planning, who we are going to train, how you are going to recruit, and the number of staff that you need. Because it cannot be that a radiologist does not come to work, so every patient has to be sent home. I don't know how long the radiologists will be away, how many procedures will have to be postponed, with what result? How many radiologists do we need at the QEH for it to function well? Do we not have access to somebody who is on call, who is a spare? I know that there are some aspects of cardiac care that cannot be performed at the moment because we don't have the specialist cardiology nurses, and we have not been able to recruit them for some time. We need cardiac technologists, and it isn't just in cardiology, it is every single specialist skill, because we put these departments in place without the necessary long-range planning, without putting in place the financing for the staffing that you are going to need over time, the downtime that the staff will need, the replacements you are going to need, the fact that you're going to have to rotate them out of active service so they can keep upgrading their skills as the technology changes. All of this has to do with planning. And these are therefore issues to which we have to treat as a nation and as a government. And I am not talking about opposition and independent senators, and I mean as a government, because we, those of us in this place, are the government. We can talk about the partisan divisions at another time, and I'm happy to do so on another occasion. But today, on this issue, as a government and as a people, we must be united about how we go forward. There are some, I was making the point about, I was talking about the hospital as an institution of development, and the hospital itself being developed. There is a difficult question that I don't think any administration has truly confronted, and it is, as a developing country, what package of services can we truly afford to deliver free to every Barbadian and sustain that delivery at a high quality standard? Because you cannot keep adding to the services that are delivered without looking at the cost and the sustainability over time. And this is part of the challenge that we are seeing now in the delivery of care. We've continued to add new services, new interventions, new specialists, new specializations, but we have not truly asked ourselves, what is the carrying capacity of the human resources of the institution? And how do we develop the human resource needs and skills of the people who work within that institution? So what packages can Barbados afford? Not the BLP, not the DLP. What package of services can the government and people of Barbados afford to deliver to its population, to give good and effective health care within a range of services that are needed? Because let's face it, you can't give everything. I want to, and in saying that, I want to pause to really congratulate all of the members of staff of the QEH for continuing to give care during COVID in the context of all the difficulties, personal challenges, fear of a new highly contagious disease which put them at risk, and against a backdrop where when you looked across the developed world daily through news and internet, you saw hospitals collapsing under the burden. You saw healthcare professionals really fall down under the weight of what they were being asked to do. But the professionals in health in Barbados put their feet to the task day after day and carried this nation through a very difficult period, and I salute them. So in terms of our long-term planning, what really is our vision for healthcare in Barbados? How will private and public sector work together? How will we finance that healthcare? And in financing, I make the point that we have looked to government to finance the QEH because it is a public institution. But the time has come when we are to ask ourselves, what are the models for sustainable financing used in the international world? How can some of those models be adapted to or replicated for use here in Barbados so as to make financing of healthcare sustainable over the long term? That is not a discussion that we have had. And it ties back into the point that I was making about the package of services that we can afford to deliver as a people and as a nation. There are cost centers in the hospital that generate revenue. Are we maximizing that revenue? Are we ensuring that there is proper billing? I have been into a hospital in the United States. They can tell you right down to the last Band-Aid that you use and bill you for it too. A 2-day, I think it was 2.5-day hospital stay in the United States cost me $26,500 US. You are billed for everything right down to the last Band-Aid. Thank God I had insurance. Here, a person leaves hospital without a bill, without even having any idea what their services cost. And even those people who are supposed to pay may or may not get a bill in due course. And if they don't pay, nobody follows up. There isn't anybody who is put to call to say, nearly said Mr. Jones, Mr. X, you owe the hospital a certain amount of money for this. Can you please come in and pay? Can you make an arrangement to pay? People come from overseas and walk in and get high quality care free and say thank you very much and go along. In fact, some don't say thank you at all. So these are issues that we have to look at, and I'm not advocating that we move from a model of free healthcare for our people. I'm simply saying that there are ways of generating financing to help to carry the hospital, and we have come to the point where we have to examine what those models are and use them, that we have to use insurance as well, and we also have to ensure that those centers which should be cost centers, now I don't know, are working optimally. I don't know what happens now, but I know that if you ask a foreign hospital for a health report, the hospital makes a lot of money on the delivery of that report to the patient. Here, there was a time when the doctor made the money for delivery of the report, even though it was a government institution, but the hospital itself did the amount of money that the hospital made on medical reports, even where there was compensation coming back from the insurance companies, payment coming from the insurance companies was minimal. So there are areas which we must look to determine whether or not government is getting the kind of resources, of revenues, beg your pardon, that it could get from a hospital, because healthcare can also generate revenues. There are aspects of healthcare which can generate revenues. Now that takes me again to, as a natural segue into another point. And it is the point of technology and the use of technology within the context of the hospital structure. The Honorable Senator Haynes made the point that, there is to be funding for a new technology system, and I'm very glad to hear this, that we can get data mining from it, that you can get critical information. You cannot plan effectively or well unless you have access to basic data. How many people use the hospital? What do they use it for? Where are your wait times, and why do they exist? What is the average age of your patient? What are they suffering with? All kinds of information needs to be generated for the purposes of planning care delivery and planning hospital management, the management of your beds, the management of your supplies. And that is part of what the technology has to be used for. Often one hears, the BWR ain't got no this, but there is an excess of that supply, whatever it is, in the C wards. But if you had proper management systems, proper technologies, with the touch of a finger, you would be able to tell what your quotas are, what the level of your stock is, what your supplies are, and where they are located, so that you could rapidly move your supplies from point A, where there's an excess, to point B, where there is a deficiency or deficit. On the point of technology, and I'm winding up, sir, knowing that I have used in about my 15 minutes. In relation to the technology, I spoke earlier about my experience at a foreign hospital. I went into the hospital, I gave my name, my address, my ID, and my health insurance number. At that point, I was embedded in their system, so that when I went to the ward, or when I went to the pharmacy, or when I went wherever I had to go, or when these services came to me, everybody had all my data. I got a medical opinion in New York, and decided I wanted to come home to see a Barbadian specialist when I was living in New York, that is, for a second opinion. And I had to go into QEH to be taken into surgery for, biopsies and so to be done, and analysis conducted. It was a process of hours and hours. I had to go to admissions and give my name and all of my information. I had to go to finance and give my name and all of my information. From there, I had to go to a ward, and on it went, walking about, and repeating the same thing for a whole day. Because the technology did not allow the hospital to say, there is now a patient called Henrietta Elizabeth Thompson. She is coming in on Tuesday morning at 7 o'clock for X procedure. She will need pharmaceuticals, access to this theater, her payment information, her bank number is so-and-so, etc., etc. In this day and age, we really should not be operating like that anymore. We really shouldn't. So we have to have and be able to spend money to have proper technology that allows us to deal with the range of things from equipment and supplies, maintenance of equipment and supplies. How old is a piece of equipment? How regularly has it been serviced? When does it need to be serviced? What replacement parts do we need to stock? To have JIT or just-in-time systems of management and so on. All of these things. The hospital needs strengthened management systems at every level. And that is not a criticism of anybody. It is a suggestion for how we need to operate going forward. I believe, sir, that I have used the half hour allocated to me. It is something, I've spoken to an issue about which I feel strongly and passionately, and about which for which I have spent some of my professional time engaged at the level of a health minister. And as I've said, I've accessed services. I believe twice I had spent brief periods at the QEH. I started by making the point that the QEH must not just be an institution for the poor, it must be our tertiary institution in which all of us can feel a sense of pride. I would wish then to close by saying that the QEH must also be an institution of care. And in caring, it is the person for whom we are caring. And that means that we have to communicate with those persons. Very often, people waiting in A&E, people waiting with relatives, people on wards in fear, do not receive adequate communication, regular communication, in language that they can understand, that speaks to what is going to happen to them when they are at their most vulnerable. I want to close, therefore, Mr. President, sir, by thanking all of those who have worked to deliver quality health care to Barbados, who have kept this institution going over the years, who have earned its reputation to date, and it does have a strong reputation. But I want to urge all of those who are still working in healthcare, whether at the level of policy, at the macro policy level, at the policy level within the QEH, or at the operational level, from doctors to the people who work in all of the various departments. Our country is depending on you. Serve within this institution so that it can be one of excellence. Serve exceptionally in the way that all of our people deserve, because an institution of care requires your demonstration of caring for the individual who comes there. I'm much obliged to you, sir.
Senator Moroni.
Thank you, Mr. President. Mr. President, let me thank all of those who have contributed to date to the discussion. I want to note the contribution from Senator Haynes, Senator King, as well as the contribution from Senator Maynard. And, Mr. President, the very substantive contribution that we've had from the former Minister of Health with her vast experience that has brought to bear on the deliberations today. I also acknowledge the questions that have been posed by Senator Tate, Mr. President, and I will seek to respond to those questions. Mr. President, this government is building a national project. And in the context of building a national project, with the resounding mandate that we have been given, and I say the resounding mandate, not, Mr. President, to rub that in anyone's faces or show off, to just state a fact. This government has been given a resounding mandate twice. That resounding mandate was a repudiation of what was there before. It suggested through the mandate that the people of Barbados wanted a different approach. The people of Barbados, through its mandate, indicated to the government that it wanted a government that would deliver. In the context of this national project that this government is doing, we can choose to take an approach that says that we will continue to rely on the status quo and we will go slowly in the context of the people's work. Or we can take an approach as a government that suggests that we will be responsive and serious about attending to the challenges that this country faces. And that is the approach that this government will take. The pace at which we might do so might be an affront to those who are accustomed to a slower pace, Mr. President. It might be an affront to those who were accustomed to a government that the people of Barbados repudiated because they wanted a different approach. The pace of this government's work will, of course, stand out because it is in direct contrast with everything that was before and that was rejected, Mr. President. So we as a government make no apologies for the pace and the seriousness and the level of responsiveness with which we intend to go about the people's work. As a government, Mr. President, we will course correct if we have to, and again, there is no apology for that. Because we can either decide that we will wait for perfection until every I and every T is dotted, which is a criticism that we have of the public service, or we can move forward, again, in making sure that we attend to the people's business and this national project. These are uncertain times. These are not the same times, Mr. President. And the context of the times which we are in requires, therefore, that we have a different approach about how we, as a government, attend to the seriousness, to the serious challenges that this country, the people of Barbados is facing. It is interesting for me, Mr. President, the suggestion that the overwhelming mandate that this government has been given twice by the people of Barbados suggests that this government does so without the level of sensitivity to the suggestion that we will have or can have a one-party state or one-party government. It is interesting for me, Mr. President, particularly in the context that just over this weekend, we would congratulate the Democratic Labour Party for the election of a president, Mr. President. It might be causing some level of confusion since the election of that president was a person who was a former member of the Barbados Labour Party. So there might be some confusion with people thinking that indeed we have a one-party state. But we are not selfish in sharing our talents within the Barbados Labour Party, and that we are open, as we have been, to be able to let the talents of the Barbados Labour Party shine forth in all spheres of society. And we therefore congratulate the recently elected president of the Democratic Labour Party in that step. It is interesting for me as well, sorry, Mr.
Before you continue, Senator Moran, I would ask Her Honor Senator Thompson to take the chair for a moment.
Please continue, Senator Monroe-Knight.
Thank you, Madam President. Madam President, it's interesting for me that we could have a discussion which would suggest that this government has been anything less than sensitive in the way that it has chosen to govern. It is interesting for me, Madam President, that sentiment could even be cast abroad when this government, through its actions, has tended in every sphere to ensure that it talks and speaks to its citizens, perhaps more than any other government has done before. And again, in stark contradiction, that we have a prime minister in the context of a pandemic that made herself available at every single step of the way to speak to the citizens of Barbados. That this is the government who has an agenda for accountability and transparency, Madam President, who has an agenda for revolutionizing the way that we engage our citizens in social policy. That the suggestion that this government is somehow using its power in a way that will seek to trough the ability of Barbadians to fully participate, I think is unfortunate. And it's particularly unfortunate in the context of this particular amendment. Because, Madam President, it's ironic that this particular amendment has made the way for the membership of a trade union activist that has been one of the most vociferous in his opposition to the government. It's interesting that, again, that we are being accused as a government of using our power bluntly when in the action of the thing, we are seeking to open and broaden the process for representation of the widest possible. This amendment, Madam President, moves the membership of the Queen Elizabeth Hospital Board from 13 to 15 in order to bring greater skills on. And Madam President, I want to very frankly address the suggestion that industrial relations specialist is the same thing as a trade unionist. Madam President, I have spent quite some time of my formative years as a trade policy specialist. I've worked quite closely with the National Union of Public Workers, with the Barbados Workers Union, doing training and working with trade unionists. And I'm sure that they are perhaps in much angst by the suggestion that an industrial relations specialist is the same thing or equivalent to having a trade union voice, an institution on the board. In fact, Madam President, it was the president of CITUSA publicly, who indicated that the QEH board needed to have a trade union representative on in order to bring the sensitivities of workers to the fore. Madam President, I would want to suggest and put on the table that when we look at the practice of the industrial relations specialists, very often they stand in opposition to the trade union voice. Very often in a negotiation, they are on one side of the table, industrial relations specialists, and trade unions are on the other side of the table, Madam President. I also, as well, would like to inform this honorable chamber that, in fact, the representative previously who was on the QEH board, the lady who was on the QEH board, not the gentleman, Madam President, the lady who was on the QEH board, who was representing both human resources and industrial relations specialists, was not, Madam President, a trade unionist. Because that suggestion was brought that somehow the government was fooling the public because we already had a trade union representative on the board, and therefore we were somehow Madam President, attempting to bring something or bring someone through the back door or suggest that someone was not functioning. Madam President, this amendment is about buttressing. It is about building. Sorry, Madam President.
Thank you very much, Senator. I'm going to ask you to pause at the back door. I think you are making a point about bringing somebody through the back door so that the President can return.
Thank you very much, Your Highness. And so just a procedural note, in these circumstances where I'm leaving the chair temporarily, there's no need to stand, just as when we're going into committee and so on. You're just another the presidency is continuing. Senator Mulroney, please continue. Thank you very much.
Thank you, Mr. President. Mr. President, I also just want to also comment just in terms of the practical nature as well of the amendment. With reference again to the specific act, and as was indicated in the House, we had read out a list of disciplines, that the board needed to be able to ensure that it had to put together. And the suggestion is again that those specific list of disciplines also as well amounted specifically to the number of persons. And I want to suggest, Mr. President, that one of the skills or areas identified here is that of law. Mr. President, law is not one of the things that I am going to put my hat on the table to say, it's not one of the things that is a skill of mine. But I only want to comment that my knowledge would suggest there are different kinds of lawyers. Yeah, there are different kinds of lawyers. It says law, there are different kinds of lawyers. So you may have a corporate lawyer. The hospital may have need of someone that may have to attend to, I don't know if it's criminal matters, so that the indication of the discipline does not necessarily then have to also equate, Mr. President, to the exact number of persons that are there. If it is that in the context of looking at the specific challenge facing the board, that it may need to be able to have a number of skills on board. Mr. President, as I wrap up, I want to perhaps echo the sentiments of that was on the table in relation to one, us focusing on the achievements of the Queen Elizabeth Hospital. The fact, again, as I've indicated, Mr. President, that quite frankly, the government is not saying that all is well. The government is not coming to this honorable House to suggest that we have done 100% of the very best. The government is not coming to this House to say that there are not things that still need to be worked on, that there are not issues that are confronting our healthcare system that are affecting the quality of delivery to citizens. Mr. President, what it is that we are saying is that we are acknowledging those deficits. We are acknowledging those deficits and in the process of working to correct. And one of the fundamental pieces of that puzzle as we work to correct has to be dealing and addressing with the issue of leadership and management. Yeah? And this is fundamentally what this amendment is about. Ensuring that we will be able to have the requisite skills. Mr. President, at the end of the day, and I think it was said on this floor already, we can dot all of our I's and all of our T's, but at the end of the day, what is it that will get us to ensuring that Barbadians who need to have it, who need to be able to access it will have the best possible health care, Mr. President. That has to be at the forefront of our efforts and our discussions. That has to be at the forefront of how we build out for the future Queen Elizabeth Hospital. And so that as we reflect, Mr. President, on the state of the hospital, we reflect on the efforts of the government to change and to improve that are ongoing. Mr. President, I talked before about a marathon. It is a marathon. And as I close, Mr. President, I want to call on all Barbadians, to support the efforts of the Queen Elizabeth Hospital, its leadership, and its staff. I want to call on all Barbadians to recognize the fundamental contribution that this institution has made and continue to make, even in the midst of the challenges. I want to ask all Barbadians to let us put our hands to the plow as much as we can, to assist where we can, to offer recommendations, to be patient as well as we work through, as we strive to address these challenges, Mr. President. I thank you, Mr. President, for your attention. I beg to move, Mr. President, that this House now be dissolved into committee for further deliberations. Sorry? I now beg to move that this bill be read a second time.
The question is that this bill be read a second time. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Mr. President, I beg to move that this House be dissolved into committee for further deliberation.
The question is that the Honourable Senate resolve itself into committee for further consideration of this bill. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
The Senate is now in committee.
Clause 1.
I'd like to move that clause 1 stand part. Oh, very important.
I say that.
Yeah, Madam Chairman.
Madam Chairman, I beg to move that this clause 1 stands par.
The question is that clause 1 stand part. All honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 2.
Madam Chair, I beg to move that clause 2 stand par.
The question is that clause 2 now stand par. All honourable members in favour, please say aye, and those against, no. Methinks the ayes have it.
Clause 3.
Madam Chair, I beg to move that clause 3 stand par.
The question is that clause 3 stand par. All honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Report.
Madam Chair, I beg to move that you do now report to His Honor the President the passing of one bill in committee.
The question is that I do now report to His Honor the President the passing of one bill in committee. All honourable members in favour, please say aye. Aye. Those against, say no. Oh, methinks the ayes have it.
The chairman has reported to me the passing of one bill in committee.
Mr. President, I beg to now move that this bill be read a third time.
Question is that this bill be read a third time. Honourable senators in favour, please say aye. Aye. Those against, please say no. The things the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the Queen Elizabeth Hospital Amendment Act 2022.
The question is that this bill be now passed and so cited. Honourable senators in favour, please say aye. Aye. Those against, please say no. I think the ayes have it. This bill is now so passed and cited. We revert to announcements. We have Senator Braffett this house, and we want to invite him in at this time. Welcome, Senator Dr. Braffett. Happy to have you. Senator Cummins.
Thank you very much, Mr. President. I rise with great pleasure to welcome Senator Dr. Braffett to this honorable chamber. I remember meeting Dr. Braffett many, many moons ago when I was a young Foreign Service officer at the time in the Ministry of Foreign Affairs, and you were at the time beginning your candidature to ascend to the leadership of the ICA based in Costa Rica. And I have known of your illustrious contributions in area of agriculture and agricultural development and in much wider spheres, even beyond agriculture, since that time. And I am pleased to have you join us as an independent senator in the Honorable Senate. And so I wish you welcome, I wish you well, and I'm looking forward to your very well-known contributions to this chamber. On behalf of the government of Barbados, I welcome you to the Senate.
Thank you, Senator Cummins. Senator Dr. Rogers.
Thank you very much, Mr. President. I rise to, on behalf of the independent senators, welcome Dr. Brathwaite to this honorable chamber. I had the opportunity to interact with him last year virtually when we were working on the Charter of Barbados, and he had great input into that, and we look forward to his contributions here, given the expertise that he brings to the chamber. So welcome, Dr. Brathwaite.
I do want to add my words of welcome to you, Senator Dr. the Honorable Chelston Whitley da Costa Brathwaite. Your achievements and your contribution to Barbados are as long as your name. And we certainly, those of us who served in the government previously have known of you before we even met you. We heard of you as a distinguished international public servant, and then we had the opportunity to support the candidature for the head of ICA, and subsequently you became our ambassador to China and many other areas of distinguished service. And we are happy to welcome you as a legislator and look forward to the same enthusiasm, expertise, and dedication that you have demonstrated in all of your many other areas of service to our country, to our region, and our hemisphere, that you will continue along that same vein in your contribution as a legislator through the Honorable the Senate. So I warmly join in welcoming you to our chamber, and we look forward to your contribution. Senator Dr. Brathwaite.
Mr. President, fellow senators, ladies and gentlemen, I'm indeed honored and humbled to be invited to be part of this august body. When I was invited by the President of Barbados, the Most Honorable Dame Sandra Mason, to be a member of the Senate of Barbados, I saw it as a responsibility and an opportunity to give back to my country, because I have received so much over the years. The President, unfortunately, I did not receive notice of this meeting until about an hour ago via telephone call. Apparently, the email that was supposed to have been received by me did not arrive. And it reminded me so much of the fact that once in my youth, I was not enrolled in a particular school because my name was said to be too long, and I was not entered into the computer at that time. I hope, Mr. President, that the length of my name will not be a challenge for communication with the Senate. Mr. President, over the years, in receiving my education at St. Matthew's Boys' School, at the Morton High School, at the University of the West Indies, at Cornell University, at every stage in that process, I receive the support of my country. The nomination to the Senate, therefore, is another defining moment in my life journey, a moment that I will treasure forever. And I hope to use this opportunity to help to make Barbados a country that is just, independent, fair, and prosperous. I hope to bring to this august chamber my 50 years of experience in management, in diplomacy, in agricultural development, and to bring, I hope, the experience that I have gained in living in 7 countries of the world. I hope, Mr. President, that I bring to the debates of this chamber constructive analysis of issues based on that experience, to support proposals that support the advancement of Barbados and its people, to help to build a ship of state that is fit for purpose and that can confront the challenges which we face today, and to contribute to proposals aimed at making Barbados the best small island developing state in the world. Mr. President, as I look to the future, I'm reminded of the words of the great apostle of peace and brotherhood, Mahatma Gandhi, who led the successful campaign for India's independence from the British. And in his writings on leadership, he noted that there's 7 key things to success and progress, and indicated that if we're not careful, these 7 things could destroy us. Wealth without work, pleasure without conscience, knowledge without character, commerce without morality, worship without sacrifice, science without humanity, and politics without principles. I hope, Mr. President, that this chamber will be an important instrument to ensure that these negative tendencies do not undermine our development. Because at the end of the day, the measure of our success as a nation will not be the number of cars or the number of cell phones we have in this nation, but it will be whether we have built a society where all our citizens can participate in the benefits of our development, and where we have developed long-standing mechanisms to provide for security, health, education, energy, water, and food for the people. It is clear to me, Mr. President, that we must build a society that is technologically prepared, environmentally managed, and socially equitable for our people. We stand today, Mr. President, at a very important moment in our history. Today we face the grim prospect of war, the prospect of a third world war, with all the negative consequences that such an eventuality could bring. One of the serious consequences of a war is that we face the prospect of greater food insecurity, because the nations involved in this war are major contributors to the food of the world. In fact, Russia and Ukraine produce almost 1/3 of the grains of this world and about 1/3 of the fertilizers for agricultural development. During the previous global conflict between 1939 and 1945, the Second World War, Sir Sidney Johnson, I believe in these same chambers, was able to introduce legislation to ensure that the plantations of this land use 12% of their area to produce food. That ensured that the island could feed itself despite the blockade by German submarines. Recognizing the importance of food security for national development, on my return to Barbados in 2010, I helped to develop a plan for food security and agricultural development in this nation in cooperation with the American Institute for Cooperation and Agriculture. We prepared a new vision for agriculture in Barbados based on refocusing the agricultural sector from one based solely or primarily on sugarcane to an agricultural sector based on food. Unfortunately, Mr. President, those proposals were not implemented by the then administration. I'm therefore pleased that the government that took responsibility for the management of the affairs of this country in 2018 has taken bold and progressive steps to improve food security in Barbados. Mr. President, without higher levels of food security, our development efforts can come to a halt, and our independence can be undermined. I therefore pledge to do all that I can to help to promote food security in this nation. Mr. President, this should be an exciting time in the Senate, I hope, as the government seeks to redefine our place in the world and to usher in an era of more justice, more accountability, more peace, economic diversification and prosperity. I hope to lend my voice to the debate that seeks to build a modern Barbados of justice, peace, and prosperity for all, especially in the context of a war, a COVID crisis, and climate change. Speaking of war, while the current crisis between Russia and Ukraine is of immediate concern for all, it is clear that there are pockets of social injustice and conflicts around the world. I believe, therefore, that we must plan, we must perform, and we must pursue sustainable options that can promote a society that puts people first and locates them in the center of our development paradigm. I aim to be a voice of reason and constructive analysis of issues which confront our society today. Mr. President, each nation faces different obstacles and challenges and has different goals, shaped by the vagaries of history and experience. And as we meet here today, here in Bridgetown, in distant lands and in lands not too distant from here, innocent people are being slaughtered in war. Discrimination and racial inequality continues to dominate the fabric of some of the so-called democracies. And wealth is being lavished on arms, on an exploration of space. These different approaches to development are occurring while at the same time, we face the reality that reflect the imperfections of human justice and the inadequacy of human compassion. Mr. President, the recent published chart of Barbados, which sets out the vision for the future to be a truly independent, fair, and just society, is a call which we all should share. I aim to be a voice for those who are less in doubt. I aim to be a voice for the farmers of our country who work tirelessly to feed this nation in the face of national and international forces. A world of opportunity exists, but we must move forward to aggressively grasp the opportunities by cooperating strategically with those who have achieved. Mr. President, Brutus said to Cassius and Julius Caesar, "There's a tide in the affairs of men which taken at the flood leads on to fortune. Amid it all, the voyage of their life is bound in shallows and in miseries. On such a full sea are we now afloat, and we must take the current when it serves, or lose our ventures." Mr. President, COVID, the prospect of a third world war, and the continuing challenge of climate change challenges our survival. We must therefore take appropriate steps to consolidate our democracy and to ensure that our country continues to create an atmosphere of resilience and capacity to face the tremendous challenges which we face. The challenges of our time do not require less discipline. They require more discipline. The challenges of our time do not require less hard work. It requires more hard work. The challenges of our time require more of all the things that have made us proud. We must rekindle, therefore, the flame of hard work and strive for excellence, that although small, we can stand tall among the nations of the world. We must rise to the challenges of our time and work harder for a better tomorrow. As we have overcome the difficulties of the past, so I think we can conquer the challenges of the present. Mr. President, I believe that we must work together to open windows of opportunity and provide rays of hope for the people of this country, so that they too can look to horizons beyond those to which they were born and can strive for greatness. I hope that I can contribute in assisting in producing the men and women of the 21st century who will be responsible for the continued progress of this nation. We must also ensure that Barbados becomes one of the most successful countries among the small island developing states. Mr. President, with God's help, let us continue to work together to make Barbados the greatest small island society in the world. I thank you.
Thank you very much, Senator Dr. the Honorable Chelson Brathwaite. Senator Cummings.
Thank you very much, Mr. President. I beg to move the suspension of this sitting for 1 hour for lunch, and then we will return to continue debate on the second item on the order paper. Can I ask as well, Mr. President and colleagues, that before members of the Senate leave the Honorable Chamber, that you confer with the Clerk of Parliament to ensure that your email addresses are correctly entered in the Parliament's database, and that you do not have messages from Parliament in your junk mail, perhaps, because I believe all of the emails, I am told, have been sent to everyone. So let's just make sure that all of our email addresses are correct and that we don't have junk mail. Thank you. We will reconvene at 20 minutes after 3 p.m. Mr. President, is your proposal?
The question is that this sitting be suspended until 3:20 p.m. today. Honorable senators in favor, please say aye. Those against, please say no. Methinks the ayes have it. The sitting is therefore suspended.